I want to ask you what you're hearing from your constituents this morning and those who maybe wanted to see a vote take place. Is that because they wanted some blame to go around, or they wanted to be holding those lawmakers accountable because they didn't get that vote?
Yes, I just voted I just spoke this morning out in Rockingham, North Carolina, a small rural community, to a number of our Republican members out there at their county convention. And they were absolutely livid. They were so mad that we did not pass this bill, that there are a number of people who held out, 20 or whatever people who would not agree to make sure that we could pass this conservative reform. And they just were very angry because they knew that this would bring health care back to the states, it would lower the premiums, it would give health care back in the hands of the American people, it would reform Medicaid, it would reduce taxes by $1 trillion. Remarkable reform.
But sir, if I may interrupt you, because it does sounds great on paper, but wouldn't the Senate have just punted it anyways? I mean, would we have seen any progress in the upper chamber?
Well, you take it to the Senate. That's our democratic process. That's how we legislate. We pass this bill in the House, and they take it to the Senate, and then they do the reforms that we want to do. Then it comes back to us. So I think we had to go to first base. First base was important, and we didn't get to first base this time. Beyond first base, then the Secretary of Health and Human Services has the right to address 1,200 rules that were written in this law when it was that the Secretary of HHS had the right to determine those rules. And that after that, then we were able to go into the third phase, which would be legislation that would open up state lines and would allow us.
Okay, I want to ask you quickly. We've been talking about that that opening up state lines, perhaps in a later phase in this particular legislation. My last question is: Democrats are cheering this morning. Should they be cheering?
Well, they shouldn't be cheering when next month they're going to have an increase in rates again from the carriers. This is the reform that they passed, the bill that they passed, is collapsing on its own weight. When Aetna says that it's on a death spiral, when Humana says that they're leaving next year, there's no opportunity for this health care plan that they passed to succeed, and it has to be reformed.
All right. All right, Congressman Pittenger, thank you so much for joining us again. Happy anniversary. Thank you, sir. We appreciate it.
Sure. Thanks.